compliment to me and everyone who's chatting in the chat about all of this. Amazing. Eleanor's a brilliant insight, and to me, I know you're doing incredible work in Reading, so thank you for that. Okay, Catherine, I'm going to turn off
Yeah.
my mic and my camera and hand it over to you guys.
Brilliant, thanks. Right, thank you, Katie. That was really fascinating. Now we're heading over to hear from Alison Whittaker Stewart about We Are Undefeatable in Blackburn, Blackburn and Darwin, and looking at storytelling. So it's kind of building on the last piece, but really understanding people in depth. And Alison is the physical activity campaigns lead for Together an Active Future. They're an organisation we've worked with our flagship programme actually in Burnley for the last sort of 6 years. They've been delivering Beat the Street and using it to build an entire new strategy for a whole town around an outdoor town. So we love working with them, TAF. They're one of the Sport England's place-based partners. So over the last 2 years, Alison's worked closely with the national We Are Undefeatable campaign to deliver a localised version in Blackburn with Darwin, followed by Healthy Hearts in Lancashire as well. And an integral feature of both campaigns has been Alison's commitment to amplifying the voice of local residents, especially those living with long-term conditions, and really empowering them to share their lived experiences to inspire others to be active. She's a chartered marketeer specialising in health promotion, stakeholder engagement and campaign development. So Alison, if you'd like to take over, I can see your slides perfectly. Welcome.
Brilliant. Thank you very much. And thank you very much for inviting me to talk about the campaign today. I've really enjoyed listening to the other speakers this morning as well. So can you hear me okay?
Yeah.
Okay, brilliant. Okay, so let me go on to the next slide. Next slide. I want it. There we go. So we do have a video, but in the interest of time, I'm not going to show it all. Hopefully it'll work.
Did you want sound?
Oh.
The sound's not coming out.
Oh, is it not?
No, if you go back to share, just click at the top right, include sound. So just come out and pop back in. Look, I sound like an expert on Teams now, which is hilarious after today. But it is top right when you share.
Okay, let's move. More options.
Oh no, you have to come out.
I'll have to come out my whole presentation though.
Yeah, it's share. It's at the very start, unfortunately.
Okay, let me carry on the cut, and if people want to watch it afterwards, they can do. That's a shame. I had sound perfect, so I don't know why nobody else did. Technology is great when it works, isn't it?
We've got time. It is worth doing.
Yeah,
do it. Yeah, because it's so brilliant.
So come out. There we go. There we go. I think. There we go. Can you hear now? Next slide. Right, so it's gone to the next slide now. Let me share again. Sorry, I don't know why it won't let me. go from here. Zoom slideshow. It won't let me move on to the next slide for some reason. I don't know why. Can you all hear me okay still?
There is a gremlin, I'm sure. Do you want to move on manually and then come back in?
Yeah, okay. So for the benefit of those who aren't aware, We Are Undefeatable is a national campaign. It's a campaign aimed to inspire people living with long-term health conditions to be more active, to help them improve their overall health and well-being. It's led by a consortium of 15 different leading health and social care charities. And whilst we focused on those obtaining stories from 16 local residents, we reflect on the conditions that the national charity partners support. So the storytellers that you saw in the video then live with angina, arthritis, asthma, anxiety, bronchiectasis, cancer, COPD, diabetes, dementia, motor neuron disease, Parkinson's, and in addition we've also got a few other conditions that aren't We Are Undefeatable conditions, such as a rare autoimmune disorder, endocrine condition and visual impairment. I'm going to go back to this screen hopefully. So the campaign was launched in June 2024 and the initial phase of the campaign ran for 3 months. But 2 years on, I'm delighted to say the campaign is still strong and has as much momentum as it did when it started. It's been embedded in Blackburn with Darwen Council's public health strategy and has been adopted by healthcare professionals, the PCNs and a wide range of organisations in Blackburn with Darwen. It's a multi-channel campaign and assets heavily featured on both social and digital channels, utilised council's owned out-of-home assets, printed publications, posters in GP surgeries and other healthcare settings, and in council-owned buildings. And importantly, it was shared by a wide variety of partners. So let me try and get it back. Can you see?
The video's showing. I've got it. Do you want me to share it for you?
Yeah, can you? There we go.
Oh, brilliant.
Brilliant. Okay, we got there in the end. So I could talk for a long time about this campaign. It's been absolutely fascinating to work on. It's probably been the highlight of my marketing career, to be fair. It's been a pleasure from start to date. But I'm just going to kind of touch on the top elements of it, and I'm going to share quite a lot of links with you later on in the Steele section. So what I would say before undertaking a campaign like this is just stop. Don't drive straight in. We spent a lot of time doing research, obtaining data, understanding that local picture and actually what was needed. So we did a joint strategic needs assessment at first, which identified all the local health and social care needs. And then we spoke to our public health data analysis, who supplied us with a really comprehensive profile of kind of Blackburn with Darwen's health complex health needs from the Aristotle system. If you don't have access to this, I'd say Fingertips is a really good source of public health information. We then collated and simplified all of this data and insights and created a RAG table, and the priority wards were based on their IMD, indices of multi-deprivation score. This kind of gave us very quantitative information, but what we needed more. And through regularly attending the comms, insight and engagement meetings organised by the ICB, we obtained ward profiles of every ward in the borough from the Healthwatch organisation. And this gave us some really fantastic qualitative insights about the challenges some of the residents in those individual wards face. We added 2 columns to our RAG table, the most prevalent health conditions in each ward and the demographics of those residents. And we then matched our storytellers according to that ward. This, it took quite some time, but it proved absolutely integral to the campaign delivery. We shared it with the agency. It determined which of the 50 bus stops the council owned we used and which storyteller went on there. It determined how we spent our budget, and ultimately it meant that our campaign was more effective. So when we evaluated the digital and social metrics, we got really strong completion rates. Nearly 15% of viewers watched 25% of the videos, which what you saw before was a compilation of all the videos. We created a 2-minute video for each storyteller, and 6% watched them all the way to the end. Now, it doesn't sound like a high number, but it really is. This suggests that the video content we created was really engaging and resonated well with the target audience. And what it also meant was that the cost per view was really low, maximising the budget's impact. So I think it's key to highlight, because we understood the audience of each ward by looking at that public health data and targeting them with appropriate and relevant content, it made our campaign so much more successful and cost effective. We also looked at data provided by the We Are Undefeatable national team, in particular their Bridging the Gap report, and this summarised public consultation to understand how better support people with long-term health conditions. And the data informed us that the NHS, GPs and healthcare professionals are the most trusted source of physical activity advice. And this also shaped the approach, because we had a two-pronged approach. We had a kind of assets and content created for the general public, but we also did a specific element of the campaign for healthcare professionals. We created posters for them. We created a moving medicine pack for them. We spoke at all the different PCN meetings and really engaged them from the start. My second stop would be embed evaluation from the start. Really think about what you want to achieve and how you're going to measure it, and your campaign will be designed accordingly. By knowing what you want right at the beginning, you'll achieve strong participation. And I'd like to just touch on Katie's presentation. We did 2 different surveys. We did a survey to the general public. We did a survey for partners, but we got most of the insight and far more than numbers could tell us from 8 stakeholder interviews. A lot of the learning in our report is from some of those interviews. My next stop is evaluate what budget and capacity you have and tailor your campaign accordingly. So this whole campaign for We Are Undefeatable in Blackburn with Darwen, we had a budget of £50,000, which is a lot of money. And I appreciate not all areas have that resource available. So we needed extra budget because we evaluated what support we couldn't have right at the beginning. So I was hoping that my 2 colleagues, who were great with video and a graphic designer, would help create all the content for me. But when the more we went into the campaign, we realised that they didn't have the budget, they didn't have the capacity to do that. So we ended up outsourcing the creative and consequently needed more budget to do that. I would say for other areas wanting to replicate this sort of campaign, but on a much more limited budget, you could focus on the health conditions that are most prevalent to your area, rather than all the We Are Undefeatable conditions like we did. So if I was doing it again in Blackburn with Darwen, I'd be focusing on diabetes, mental health, cancer, heart and respiratory conditions. I've delivered another campaign this year that was mentioned, the Healthy Hearts in Lancashire campaign. We were over 9 different districts as opposed to 1. I didn't have enough budget for video for that. So we did a photo-led approach instead. And identify creating content specifically for that particular storyteller, as opposed to the same content plan for all storytellers. And if it's not possible for you to create your local assets, then you can utilise some that we've created and are willing to share. And also the national team have created some budgets, but that's in the Steel section. So if we go on now to the start. So one thing that we did was identify local partners from the start. And I went out to a lot of meetings in the January before the campaign was launched in the June. Those meetings were social lines prescribing groups, active Blackburn with Darwin groups, the ICB, comms and engagement networking groups. And I said, this is a campaign that's coming. It's coming in the summer. We want you to be involved. What can we do to support you in achieving your mission, and let's work together. So I work for Blackburn with Darwin Council. This campaign was something the public health team wanted to do, but it's not a council campaign. It hasn't got the council crest on any of the assets. When we intentionally did that so that the assets could be utilised by any of the partners, and they were more likely to share them. And they've been created not just to share within Blackburn with Darwin, but wider as well. So Sport England are very keen on us sharing the learning and sharing the resources for maximum capacity. So when we identify local partners early on, a lot of the local partners helped identify storytellers. So I didn't put a social media campaign out saying, oh, who'd like to be part of this campaign? What we did was went to the local partners, said what we wanted to achieve, and asked if they knew of anyone of their clients, anyone who accessed their services, who might be willing to take part. And that's how we gained our storytellers. And the fact that we paid all our storytellers as well, that was definitely incentive for organisations to ask their clients if they'd like to get involved. By involving the different organisations and them identifying storytellers, when we did create assets, they were very keen to amplify the message and share them on their channels. And many partners have utilised those assets we've created to raise their own profiles, use them to attract grant funding and such like. So it's been a win-win all round, really. Working collaboratively, collaboration has been the ultimate success of this campaign. I'm actually presenting about this campaign later on this afternoon, and I've got to talk about what do you think is the secret to success for this, and it is definitely the collaboration. We couldn't have had the reach and impacts that we've had without working with other partners for this. I would advise anyone doing a similar campaign to kind of definitely reach out to your local football club. They've been amazing in amplifying the message and across their channels, and to an audience that is definitely our target audience. They reshot the video to make it a little bit longer than we had done. They shared it on match days. They put it in their program. That was really, really good. And then it went on to be shared by the EFL afterwards. That's the English Football League. Working collaboratively as well to be inclusive and accessible. So in that, we work with the Deaf Village Northwest, and because we had BSL interpretation of the videos on for 50% of the videos, the Deaf Village uploaded all those videos to their website and shared them all on social media. Now they have 11,000 followers alone, so our videos ultimately went to a new audience they probably wouldn't have reached beforehand because we did make them accessible. We also had 2 visually impaired storytellers that and we created audio versions of those videos. Because we created audio versions, the RNIB gave me access to their closed Facebook group to upload those videos to that channel, again reaching an audience we wouldn't have done before. I think I've learned so much from this campaign, particularly to how to reach different audiences. So there was one lady called Sima. She's the lady who dances in the video and also cycles. And she said to me, Alison, you know, I'm really, really proud of this 2-minute video you've created, but it's not really shareable for me on my personal channels. She said, I want to share it with my community. And she said, but the ladies that I work with and ladies like me from Southeast Asian community, we don't really use Facebook and Instagram. We might use Reels sometimes, but we generally use WhatsApp and TikTok or, you know, short form video content. Is there any chance you can adapt the content so that I can share it on my own personal channels? So we did. I went back to the videographer and said, please can you change these? And then one of the other, Sima, blind baseballer, said, Alison, you know, can you do that with my content as well? She said, because I'm in exactly the same position as the other Sima. I was like, yeah, no problem, we can do that. Now, I didn't appreciate before I started this campaign that, and we wanted to go with Meta because it's easy to measure. It's kind of one of the council's preferred channels, but actually it wasn't reaching the target audience. So going forward, I would create a content plan for each of the storytellers based on their audience, based on their preferences. I think be able to reduce the budget by doing so as well. So Steel, as I mentioned, I'm funded by Sport England, and Sport England's culture is for us to share our learning so that impact can be wider. We've created a Share the Learning, of learning and impact report. It's very comprehensive. It will hopefully answer any questions that you've got that I can't possibly cover in this amount of time. And you're more than welcome to read it. I'll post links in the chats afterwards. We appreciate that not everyone has the resource and capacity to create the assets we've done. So we've created a campaign pack, which you can visit our website and download all the different social assets we've created. You can utilise the videos we've created as well. The videos have backdrops that our local residents would recognise in there, but the photos, we've been very conscious so not to feature iconic landscapes so that they can be shared much wider. And the national team have also created a campaign hub where they've put templates together, and you can insert your own photos and insert your own text and insert your own logo as well. So those are definitely my steals from this. Yeah, if you've got any further questions, oh, here we are. Sorry, I should have clicked on those. Those are the campaign assets that We Are Undefeatable national team have created for others to use. And if you would like to find out more, scan the QR code, or you can get in touch with myself. All my details are there, or my colleague Peter Dutton, who sadly couldn't be with us today. So yeah, I think that's taking me up to 5 minutes left, and time for a few questions if anyone's got any. Thank you for listening.
Thank you so much, Alison. Oh my goodness. Is Catherine around? Just check the chat. Great feedback from here. Fascinating talk. Thank you. Interesting you paid your storytellers too. Do you mind sharing how much you paid them to take part and what the overall budget was for the campaign too?
So we paid our storytellers £250 each, and we didn't word it as a payment. We worded it as a token of our appreciation for their time and consent. It's interesting that some of the storytellers didn't want the money. They weren't doing it for money. They just wanted it to help inspire other people because they knew how much they benefited from it. I did ask them to take the money, and if they wanted to donate it, then they could do. Other storytellers were definitely kind of, inspired by the payments. But many of the storytellers can't work because of their conditions, or there's lots of additional pressures when you're living with some of these conditions. So we felt it was morally and ethically the right thing to do. The overall campaign budget was £52,000. That includes everything.
Thank you, Alison. Absolutely fascinating. I almost love how you shifted it to be about the storyteller, because in good marketing and comms, they always say to talk to the person as an individual, don't they? And that happens really naturally, but it also means that you know you're being inclusive, you know you're bringing the right people forward. Any other? I'm just checking the chat. Catherine, I know this is your area.
Yeah, in terms of questions, I think that was the how much you asked you gave to the partners, to the storytellers, was the main question, and then there's some really good sharing of examples they've done, other people have done. So Justine Williams has developed a mental health campaign in collaboration with NHS, local authority, voluntary sector, and that's the same as you. The partnership approach has been really, really key. And how do charities get involved in the campaign?
So we in Blackburn with Darwin, I went out to speak to the different networking meetings, and the charities that were there who identified a storyteller approached me and said, I think I know someone who'd be great for this. What do I do next? I said, go and speak to that person, see if they are up for doing this and want to find out more. We were then introduced. I had a telephone call with that storyteller just to kind of say, this is what's expected. Does that sound okay? And then I went to meet them for a coffee and write up their story, and it went from there really. But I think are you based in Blackburn with Darwin? Is Backup based in Blackburn with Darwin? I think it will be contacting your local team, whoever that is, if they're considering doing a campaign like this.
Okay. Yeah. Oh, thank you, Alison. And Catherine, did you have any reflections just from the physical activity space, how it works in synergy with what you do?
Yeah, I meant just to say that I think it's brilliant and it's really good. And I think one of the key things is the benefit of sharing that good practice and spreading it rather than having to start from scratch. I think that's a really valuable thing that the place-based working's doing. You don't have to start from scratch each time. You can learn and replicate or tailor to your own area and your own needs. It's really good. So great to hear it. Thanks, Alison.
Welcome.
Yay, thank you so much, Alison. Honestly, so inspiring. And we'll move on now to Paul, but please hang around in the chat, Alison, for any further questions or just to connect in. And I see you've been popping some links in there as well. So thank you, thank you. So we're moving on to our final session. There's not been that many book completions, so please do pop your evaluation form in now. We're going to shift to chatting with Paul, but don't worry about that. don't worry until the end of him. Sorry, Paul. Are you there, Paul? Don't worry about just filling the evaluation form in at the end, because we really want to do the book giveaway live. I'm going to come in and just say, give me a number 1 to so-and-so, and whoever is first in the chat, I'll check that number according to the completion form. Whatever that number is wins the books. That's it. So don't forget, we've got the Do Penguins Eat Peaches, we've got the Marketing and Psychology book, we've got Advita's book, and we've got the Brain Fuel reading journal. So because there's just so much to capture, isn't there? When we were working on the Brain Fuel book club and we were doing our slightly mad bonkers 50 ways to reclaim your brain year-long challenge, which has actually fried our brains, and we're going to pop it actually a vote. If you could go in and vote for the next few books, that would be much appreciated. There's no way we can do the challenge on our own, but there's just so much, isn't there? So not starting from scratch, as Alison has shared, is not, you know, is such a way to bridge the gap with inclusion even more, because you can focus on, can focus on who it is that you need. So you can focus on actually making sure inclusion is the center and the driving force, because everything else is done. So how can we join the book club? So George will put the book club, it's on, so we just started it, it's free for everyone. It's just where we're moving all the behavior change and marketing boot camp training in. So we're just moving things slowly over there and bringing everything together. It's on Substack, and every week you just get a different way to look at your brain. Now, the reason we are doing it, it goes back to Tom and Luann's session. The reason we are doing it through personal, like, how can you reclaim your brain as a professional working in this space, is because when we did our training, where we've trained so many people over the last 5 years, we really flagged up the most important bit of all of this learning, of everything we've been doing today, is you. How you feel, how cognitively stressed you are, or how cognitively wonderful you are. As in, we live on screens. We consume so much information. Digital has changed everything, and we work in roles where it really does impact on us. So understanding how it impacts on us is massive. And it's a really fun, easy way to learn behavioral science without sitting down and going, you know, I'm learning behavioral science now, because actually everything we do is so relevant for all of our audiences, as Tom and Luann showed this morning. So it is a bit of fun. And yeah, it's a book club. We love books. So we're doing it 1 book per week. So it's just some fun, but we can't do it on our own because we've realized